Hello everyone, welcome back to the 1000 MCQ series of Analyst Grade 3 exam and Pharmacist exam. So in today's video, we'll discuss 10 questions from the different subjects given in the syllabus of Analyst Grade 3 exam. We'll discuss question number from 571 to 580. So without any further delay, let's move on to the first question of the day. So this question is taken from the medicinal chemistry, and the question is, which of the following is a macrocyclic antibiotic? A choice rifampicin, B choice erythromycin, C choice vancomycin, and D all of the above. So the first point you need to remember, what is macrocyclic? Okay. So macro means big structure, and cyclic means a cyclic ring. So if a cyclic ring contains at least 12 atoms, okay, at least 12 atoms, then that cyclic ring is called as macrocyclic. Okay, that means this macrocyclic structures or macrocyclic compounds contain a cyclic ring with at least 12 atoms or 12 or more atoms. So that is the meaning of macrocyclic. Now, if you look at the structure of rifampicin, erythromycin, vancomycin, they all contain cyclic rings, right? And in the cyclic rings, there are more than 12 atoms. So therefore, we can call all these compounds as a macrocyclic compound. Okay. Now, which are the examples you need to remember? Macrocyclic drugs, we can remember in the alphabetical order: A, B, C, D, E, then R, V. So amphotericin, the structure contains more than 12 atoms, so it is a macrocyclic. Bacitracin, then antibiotic. And cyclosporin, which is an immunosuppressant, it is also a macrocyclic drug. Actinomycin D, also called as dactinomycin, it is an anti-cancer drug. That is also an example for macrocyclic drug. Erythromycin and all the macrolide compounds. Macrolide. Now, in a few seconds, I will tell what is macrolide. Macrolides antibiotics is azithromycin, roxithromycin, clarithromycin. So all those contains macrocyclic ring. So they are macrocyclic drug. Rifampicin, the anti-TB drug, they are also examples for macrocyclic drug. Vancomycin, the glycopeptide antibiotic, also contain macrocyclic rings. So there are examples for macrocyclic drug. Okay. Now, what is the difference between macrolide and a macrocyclic ring? Now, in macrolide, definitely there will be macrocyclic ring. That means at least more than 12 atoms in the cyclic ring would be there. Now, when we call them as macrolide is that if it contains a lactone ring, additionally, if it contains a lactone ring plus sugar groups, then we will call it as macrolide. So that is the basic difference between macrolide and macrocyclic. In macrolide, additionally, there should be a lactone ring and a sugar group, then only we can call it as macrolide. Otherwise, it's a macrocyclic. So we can tell it like that: all macrocyclics, all macrolides are macrocyclic. Okay, but the other way we cannot tell. All macrocyclics are not macrolides. Okay, now these are the examples of macrolide which you already know. You can remember this mnemonic: ear cost, erythromycin, azithromycin, roxithromycin, clarithromycin, oleandomycin, spiramycin, pro-oleandomycin, telithromycin. They are all examples for macrolide antibiotics. They contain macrocyclic ring plus lactone ring plus sugar group is present. Okay, whereas macrocyclic means that lactone won't be there, sugar group not necessary, it should be there. Okay, so these are the examples for macrocyclic drugs. Now, coming to the question, which of the following is a macrocyclic? So rifampicin is a macrocyclic, erythromycin and all macrolides are macrocyclic, glycopeptide vancomycin is a macrocyclic. So the correct answer for this question is D choice, all of the above. Let's move on to the second question. Which of the following immune cells are most abundant in the body? A choice T cells, B cells, C NK cells, D choice all are present in equal quantities. Now you know that T cells, B cells, NK cells, they are part of our immune cells, right? NK cells are also called as natural killer cells. natural killer cells. Okay, and T lymphocytes, B lymphocyte. Now, what is the difference is that T lymphocyte, B lymphocyte, they are part of acquired immunity. They are part of acquired immunity. Whereas NK cells, they are a part of innate immunity. Innate immunity or inborn immunity. Okay, so when you are born with the innate immunity. There, this natural killer cells, neutrophils, plays a huge role. Okay, whereas after a few period, this acquired immunity starts developing. That is the T lymphocytes and B lymphocytes. Now, among these T cells, B cells, NK cells, the most abundant one is T cells. T cells, approximately 60 to 70 percentage is the proportion. The number is 60 to 70 percentage, whereas B cells are just 20 to 30 percentage. Okay, and NK cells are less than 10 percentage. So the most abundant cells among T cells, B cells, and NK cells are definitely T cells. Okay, so the correct answer for this question, the most abundant cells, immune cell in the body, is definitely A choice, T cells. Okay, let's move on to the next question. Which of the following hypersensitivity reaction are cell mediated? A, type 1, B, type 2, C, type 3, and D, type 4. Okay, so we know that this drug allergy or hypersensitivity reaction is a immunologically mediated reaction. Okay, so these immunologically mediated reaction or hypersensitivity reactions can be divided into type 1, type 2, type 3, and type 4. Okay, now this type 1 and type 2, type 3, they have, you can remember this, the other names, you can remember this mnemonic acid, ACID. So type 1 hypersensitivity reactions are called as anaphylactic reactions. Anaphylactic reactions or anaphylaxis, anaphylactic reactions. Type 2 is also called as cytolytic reactions. Cytolytic reactions. Type 3, they are basically immune complex reactions. Immune complex reactions or Arthur's reaction, or it can also be called as a retarded reactions. Retarded reactions. And D stands for delayed hypersensitivity reactions. So these are the other names of different types of hypersensitivity or drug allergy. Type 1, type 2, type 3. You can remember the mnemonic acid. Okay. Now the important point you need to remember, this type 1, type 2, type 3, they are antibody mediated. These reactions are antibody mediated. So the first three, that is 1, 2, and 3, are antibody mediated, whereas type 4 is a cell mediated reaction. Cell mediated hypersensitivity reaction. Why it is called as antibody mediated? Because in type 1 or this anaphylactic reaction, the main cell is IgE, that is the immunoglobulin. Okay, IgE. So that is why it is an antibody mediated. Whereas in type 2, it is IgG as well as IgM. Okay, in type 2, it is IgG and IgM. Whereas in type 3, that immune complex reaction, it is IgG. So that is why the first three, type 1, type 2, type 3, are antibody mediated, immunoglobulin mediated hypersensitivity reaction. Whereas if you look at the type 4, I call it a cell mediated reaction because this is mediated mainly by the T cells. Okay, so type 4 or the delayed hypersensitivity reaction is mainly due to this T cell lymphocytes. So that is a cell mediated hypersensitivity reaction. Okay, so let's come back to our question. Which of the following is a cell mediated hypersensitivity? So the answer for this question is type 4, whereas all other 1, 2, 3 are antibody mediated hypersensitivity reaction. Let's move on to the next question. So it's a simple question. Ideal temperature of freeze dried BCG vaccine. So you all know that the cold chain temperature for all vaccines in India is between 2 and 8. Okay, so the cold chain temperature of vaccines in India between 2 and 8. So the correct answer for this question is between 2 and 8. Let's move on to the next question. Which of the following amino acid is primarily responsible for absorption of UV light at a wavelength of 280 nanometer, allowing for spectrophotometric analysis of protein solution? Okay. A choice leucine, B choice arginine, C choice proline, D choice tryptophan. So we all know that the concentration of a protein in a solution, the concentration of a protein in a solution can be analyzed using UV spectrophotometry. And which principle we utilize it for that? Because that aromatic compounds, can absorb UV light at a wavelength of 280 nanometer. Now, in the case of proteins, the proteins, you all know proteins are made up of amino acids. Now, among these amino acids, if aromatic amino acids are present, they can absorb UV light at 280 nanometer, and thereby we can utilize this technique for the analysis of, or to determine the concentration of the protein in the solution. Okay, so basically which all are the aromatic amino acids? So basically phenylalanine, tyrosine, tryptophan. These are the common aromatic amino acids, right? Now, since it is an aromatic amino acids, they can absorb UV light at a wavelength of 280 nanometer. Thereby, we can utilize this property for analyzing the concentration of the protein in solution. Among this, tryptophan is absorbs UV very strongly, because tryptophan contains that indole ring. It is aromatic and it can absorb that UV light very strongly. So coming back to your question, leucine, arginine, proline, they are non-aromatic. They are not aromatic. Therefore, they cannot absorb UV light at the 280 nanometer, whereas tryptophan can strongly absorb UV light at 280 nanometers. Therefore, the correct answer for this question is D choice, tryptophan. Okay. Let's move on to the next question. Netrasudil is used in the treatment of glaucoma, angina, BPH, and ADHD. Okay, so it's a simple question. If you look at the name carefully, netra means eye. Okay, so therefore this drug will be used for in a condition related to eye, and the answer for this question is Netrasudil is a new drug which has been approved in the treatment of glaucoma. Okay, so if you carefully look at the name, this Netrasudil, this contains the SUDIL. So the Sudil drugs, there are mainly, you need to remember three drugs. One is Netrasudil, and the another drug is called as Ripasudil, and one more drug, Fasudil. Okay, so all the sudil drugs, the mechanism of action of this drug is a Rho kinase inhibitor. So they are Rho kinase inhibitors. And among this, Netrasudil and Ripasudil are used for in the treatment of glaucoma. They will decrease the intraocular pressure. Okay. Now, Fasudil is used in the treatment of cerebral vasospasm. Cerebral vasospasm, and is also approved for angina. Okay, so that is the difference between Netrasudil and Fasudil. So here the answer for this question is Netrasudil is approved for the treatment of glaucoma. It's a newer drug. It is a Rho kinase inhibitor. Let's move on to the next question. How much 10% KCl solution is required to prepare 1 liter of 4% solution? So whenever this kind of problems comes, you need to write the facts first of all. So you have KCl solution 10%. You have KCl solution 10%, and you need to prepare 1 liter of 4% KCl solution. Okay, so from 10% you need to prepare 4% of 1 liter. Okay, so whenever this question comes, the compound remains the same. Okay, the concentration is different, so the volume should be different. So you can use the equation C1 V1 is equal to C2 V2. Here the concentration of the KCl what we have is 10%. They are asking about the volume what you should add. Now what we need to prepare? Yes, we need to prepare a concentration of 4% KCl. How much volume? Yes, 1 liter. 1 liter we can convert it into ml. That is 1000 ml. That is 1000 ml. So V1 is equal to 4% divided by 10% into 1000. Okay, so if you solve this equation, you will get 400 ml. Okay, so the answer for this question is C choice, 400 ml. Let's move on to the next question. So gram positive and gram negative organism are stained dash and dash respectively after the entire gram staining procedure. So in our previous video, I explained in detail what is gram staining, what are the stains used in that. Okay, so if you haven't watched, go to that video and watch what is gram staining and which are the dyes used in that. Okay, so gram staining, as you all know, it is used to differentiate gram positive bacteria and gram negative bacteria. Okay, now in the previous video I have told you, you can remember this mnemonic CVIAS. CVIAS. In gram staining, we use the compounds or the stains like CVIAS. CV means crystal violet. That is the primary stain. I means iodine, that is the mordant. A means alcohol, that is the decolorizer. And S is for safranin, that is the secondary dye. Okay, so when you take gram positive and gram negative, when you stain it with the primary stain, that is a crystal violet, the color would be violet or purple. Okay, so both the gram bacteria, gram positive and gram negative will take violet or purple color due to the crystal violet. Now you add iodine into that, it will be fixed. Now after that, you will use a decolorizer. When you use the decolorizer, the gram positive, there will not be any color change. It will be violet or purple, no change for that. But gram negative, this decolorizer alcohol will remove the color from the gram negative bacteria. Therefore, the gram negative bacteria would become colorless. Okay, so after the third step, that is the decolorization step, gram negative bacteria would become colorless. Okay, now in the next step, you use a secondary dye, safranin. Safranin is basically red or pink in color. Now what happens? The gram positive will remain same, violet or purple, but now gram negative would take the secondary color, that is from safranin, and it would become red or pink in color. Okay, so the final thing will be gram positive will be violet or purple, and gram negative would be red or pink. Okay, so these are the different staining procedures for gram positive and gram negative, and the final color would be violet or purple for gram positive and red and pink for gram negative. So coming back to our question, the gram positive and gram negative, they have asked what is the final after the entire gram staining procedure, what is the final color? The answer is purple and pink. So D choice. Let's move on to the next question. In acid fast stain, the primary and secondary dye is dash and dash respectively. So let's look into acid fast staining. So acid fast staining, it is developed by Paul Ehrlich. In gram staining, we told it was developed by Christian Gram. It is used for differentiating gram positive and gram negative. Whereas this acid fast staining is used for staining mycobacteria. You know that mycobacteria causes TB, Mycobacterium tuberculosis, Mycobacterium leprae is there, which cause leprosy. So this was developed by Paul Ehrlich. Later on, it was modified by Zeal and Nelson. Therefore, this is also called as Zeal-Nelson staining or Zn staining. So acid fast staining is also called as Zeal-Nelson staining or Zn staining, and it is used for staining mycobacteria. Now here, earlier in gram staining, I told you CVIAS, right? The mnemonic CVIAS. Here you need to remember the mnemonic CHAM. CHAM. So in acid fast staining, you remember this mnemonic CHAM. What is CHAM? C stands for carbol fusion. Carbol fusion is the primary stain, primary dye, and H is heat. In gram staining, we told iodine was the fixative or mordant, right? So here heat is the mordant. Now The alk acid or alcohol, normally acids are used, like sulfuric acid is used. So here acid is the decolorizer, and M stands for methylene blue or malachite green, which is the secondary dye. Okay, so you can remember CHAM. C stands for carbonyl fusion, H stands for heat, A stands for acid, M stands for malachite green or methylene blue. Okay, let's come back to the question. So here the answer is the primary dye is carbonyl fusion, and the secondary dye is malachite green or methylene blue. So the correct answer for this question is A choice. Let's move on to the last question of the day. Which of the following is an analeptic drug? A. Nicotinic acid, B. Nicorandil, C. Niclosamide, D choice nicotinamide. Okay, so we need to understand what is analeptic drug. So analeptic drug is also called as a respiratory stimulant. Analeptic drugs are basically, or analeptics are, they are respiratory stimulants. They are earlier used to treat respiratory depression happening in suffocation, fainting, drowning, etc. Okay, nowadays they are not preferred. Okay, so the drugs or the analeptics or the drugs which are commonly which were used earlier was examples are doxapram. It is an analeptic, it is a respiratory stimulant. Nicotinamide, and another drug PTZ, that is pentylene tetrazole. These were the drugs, pentylene tetrazole. These were the drugs which were used to stimulate respiration. They are respiratory stimulant, commonly called as analeptics. Okay, now so which the correct answer for this question is nicotinamide, D choice. Now let's look into the first choice, nicotinic acid. Or you know that it is also called as niacin or vitamin B3. They are mainly used, you can we can use it for dyslipidemia, reducing the cholesterol, the treatment of dyslipidemia. Nicorandil, you know that it is a potassium channel opener used in the treatment of angina. Niclosamide, you know that it is an anthelmintic drug. Okay, it is an anthelmintic drug mainly used for against tapeworm infections. Okay, so here the answer is nicotinamide. So hope you enjoyed this 10 questions Q&A discussions. Keep on watching, and if you are interested to enroll to our pharmacist as well as the analyst grade 3 course, download our application or call to the number given in this poster. Keep on watching. Thank you so much. We'll come with a new video. Thank you.